Okay, so we're looking at another type of injury. This is what is known as avascular necrosis. Okay, so let me tell you something. Avascular necrosis, if you check pictures of avascular necrosis, 90% of them will be showing hip joints. Now this is because hip joint is the most affected joint in the whole body to avascular necrosis. You understand? But other parts can also be affected too. So avascular necrosis just simply means this bone before used to have blood supply and the bone was a happy bone. You understand? But later on now, the blood supply was kind of like cut short, so the bone is not happy anymore. So for avascular necrosis, it's also known as osteonecrosis. So it's a condition where the bone tissue is dying. Why? Because the blood supply is no longer there. Alright, so there's no adequate circulation, the bone weakens, collapses. This can lead to what? Joint destruction over time. So what actually causes this condition? So it can be traumatic or non-traumatic in origin. Traumatic, that's when you're talking about those fractures, especially of the hip, that damage nearby blood vessels, Non-traumatic, that's just basically side effect of some things, like you have used corticosteroids for too long. Okay, then coming. It could also be that excessive alcohol consumption, radiation therapy, blood disorders. So it's all those sickle cell anemia. You are having it being accumulating in. You're having sickle cells being accumulating in the joints. It could be autoimmune diseases. Could be decompression sickness in divers. Could be organ transplant and chemotherapy. Symptoms often start silently, but as it progresses, the symptoms become louder. Right? So there's pain when you try to bear the weight, stiffness, limited range of motion, limping if the hip or knee is affected. So diagnosis of those imaging, so X-rays, MRI, CT scan, bone scans. So this is staging, where you see stage 0 to 4. All right. So this one will just help you know the severity of the avascular necrosis you are basically dealing with. Okay, that will help you know the severity. So the next thing we have here is treatment options. So early ones is also non-steroidal anti-inflammatory drugs, bisphosphonates. Moderate ones are those bone grafting, stem cell therapy, osteotomy. Then joint replacement surgeries like hip arthroplasty. So complications can lead to joint collapse, can lead to severe arthritis, can lead to loss of mobility. Alright, sometimes it might now lead to you needing surgical interventions.